Just Africa. This is where we connect ideas, innovations, and policy to the everyday lives of Africans across the continent. And today we focus on a transformation that could redefine health outcomes for millions, advancing digital healthcare in Africa, from AI-powered diagnostics in Nigeria to mobile health services in Kenya, telemedicine in South Africa and Nigeria, and drone-delivered medicines in Rwanda. Africa is embracing digital tools to overcome age-old barriers in healthcare delivery. With a growing youth population, rising mobile penetration, and increased investor interest, digital healthcare is no longer a futuristic concept. It is an urgent necessity for equity, economic growth, and sustainable development. But to realize its potential, Africa must address infrastructural gaps, regulatory hurdles, and investment bottlenecks. These are the areas that Africa needs to attend to. Welcome once again to Just Africa today. Hello to you. Good afternoon, Mavi.
Yeah, good afternoon, Priye, and good afternoon to you, Lagosians, Nigerians, and Africa as a whole. Yeah. You know, when it comes to Africa, the way the world look at us, they just assume in Africa we do not have a very good knowledge of tech, of medicine. They just believe Africa is, they are still in the dark world. But I love the fact that in tech, we have advanced. So, though there are so much profound challenges, we can't take that away, and which I believe it's common to every country, every continent, whatever. But I am glad that we're moving fast, looking at Rwanda, looking at Ghana, looking at South Africa. Nigeria, not an exception anyways. Yeah. So I am glad that we are moving very fast, and we'll be able to conquer the challenges that lie ahead, I believe, with time.
Yes, with time we'll be able to conquer the challenges. But for advancing digital healthcare in Africa, you know, it refers to the deployment of digital technologies such as telemedicine, AI diagnostics, mobile health applications, electronic medical records, and digital payment integration to enhance healthcare delivery across the continent, including accessibility, bringing medical expertise to remote villages without physical hospitals, efficiency, reducing waiting times, improving diagnosis accuracy time, and cut costs, integration connections, patients and health workers and policy makers through the real-time data and innovation. Now, using Africa's mobile-first adoption pattern to leapfrog traditional healthcare bottlenecks and conversations within this space of what we are talking about.
Yes.
So we have someone who is quite prominent in this area of conversation that we will be looking at today, and we're going to break shortly. He's standing by, he's joining us virtually, and when we come back from the break, we will be having this conversation with him. Now stay with us.
Africa Development Studies Center, ADSC, we are committed to driving sustainable growth and development across Africa through innovative training and research. Our mission: empowering leaders, policymakers, and professionals with the tools they need to create lasting change. With customized training, dynamic research programs, and study exchanges on leadership, management, and other critical development topics, ADSC offers a platform for exchanging cutting-edge ideas and global best practices. We provide comprehensive services in research and consultancy, capacity building and training, education programs, publishing, and knowledge sharing. Our esteemed faculty, composed of seasoned experts and researchers, ensures a learning experience that is insightful and practical. We specialize in policy development, implementation strategies, monitoring, and evaluation. At ADSC, learning is engaging and enjoyable. Our unique methodology includes talks, interactive exercises, games, video screenings, and lively seminar discussions. all in a comfortable and friendly environment. Ready to make an impact? For more information, email us at info@adstudycenter.com or call +234 912 439 2362. Visit us today at www.adstudycenter.com to explore our programs and upcoming events. Africa Development Studies Center, rethinking development for Africa.
Welcome back. Many thanks for joining us. We have a guest who is joining us on the program. He is Nonso Oporum. He is the founder and CEO of Fix Health, a Nigerian-based company that leverages telemedicine, AI-driven diagnostics, and mobile platforms to connect patients with doctors across Africa. With expertise in software engineering, product design, and health system management, he has led multi-country projects in Nigeria, Kenya, and Ghana, focusing on improving healthcare access in underserved communities, a recognized voice in Africa's health innovation space. Nonso, welcome to Just Africa, and many thanks for joining us on the program.
Thank you for having me.
Great. It's good to have you with us. Now, when we hear the word telemedicine, AI-driven innovation within the tech space now in health, it begins to provoke questions in our minds and in our thoughts. Okay, what are we going to use AI to do? Is AI going to conduct surgery? Is AI going to prescribe medication? Is AI going to diagnose you and tell you what is wrong with you? It begs lots of questions. So do you mind, just demystifying the concept AI and the advantage, the potential that it has and it holds for the continent of Africa?
Okay, thank you very much for having me again. I think the whole idea about AI is like trend data. It's trend over time to, bring in more informed decision based on previous histories of things that's happened, and helps it to also make more informed decisions. And in Africa, I think, for us, it's a tremendous opportunity for us because it offers a phenomenal opportunity for us. We are a continent that is facing tremendous issues when it comes to infrastructure. So what AI could help us do is to help us leapfrog in areas whereby that we are lacking, help us make informed decisions, leverage on this data to make help you in some ways make informed decisions. If you use ChatGPT, for example, you could use such solutions, such platforms to, request for writing it, maybe let's say later or something like that. So those things are written because there are data that are backed with them to help them make informed decisions. And it's not just around other sectors. This is also similar in the healthcare, in the healthcare space, because as artificial intelligence, it's an intelligence that's already trained with data to make those decisions. So what it also does is similar to the healthcare space, is helping healthcare providers, people working in the healthcare space to also make informed decisions. It could be around sexual healthcare, it could be around reproductive healthcare, it could be around simple primary healthcare things that doesn't require more physical hospital visits. So this is where the area that healthcare could help us to bridge, AI could help us to bridge that gap in healthcare access. Thank you.
All right.
All right, thank you, Mr. Nonso. Now, talking about AI is not something that we can say it is accessible by everyone in Africa, especially those in the rural areas. Now, how do we make this AI, how do people in the rural sector, in the rural areas rather, get to know that, how do I access medical facilities without necessarily having to travel to the city? Because we're saying that we are trying to see how we can make these facilities, this telemedicine, accessible by everyone in Africa. What is the plan? What is the future plan for those in rural areas?
Well, I think when we talk about inclusion, the most important people that we must take into consideration are people in the rural areas. If you ignore them, then that means healthcare access can't reach the goal of universal care. And again, when you talk about high level of mortality, yeah, infant or maternal mortality from childbirth or children losing their life before age of 5, more of these cases also come in rural areas or semi-urban areas. So, there is urgent need for bringing technologies or solutions that can enable healthcare access in places like this. So the first thing we have to do is that we must understand that yeah, it's also always good to cross-pollinate ideas, but there are regions like you rightly mentioned that we cannot take what is working in the US and feel like because AI is good in the US, we want to take it directly to people in these communities and expect that results will happen. I sell insurance, I've been selling insurance for a couple of years, and I think when we first built a mobile app, we took it to rural areas. One thing we witnessed was people didn't want to buy the product. They didn't want to buy the product because they didn't want to buy it. One thing that created high level of people pushing against those objections were because people had smartphone. It could be because their child bought it for them, or they bought it for themselves, but they didn't have data. So that means if you don't have data, you can't go online to buy internet, buy whatever you want to buy. So we had to change the model and bring in USSD. USSD means we thought of how best can we make it simple. So I think for Africa and for our own context, whether we are looking at AI or we are looking at technology or we are looking at telemedicine in healthcare space, the most important thing has to be simplicity. We must understand how to make this solution simple so that the average person, the woman that said tomato by the roadside, the woman that is disconnected, that see light 1-2 times in a day, can be able to access simple healthcare when she needs it and just how she needs it.
Thank you very much. I see that we have already started delving towards some of the challenges that we encounter, that the continent of Africa will encounter when trying to bring in health inclusion. So now, since we've started talking about that, and I also realized that you have worked in several places where you've been able to not only test how it will be acceptable, but also have first-hand experience with this. Could you please tell us some of the places you've worked and the feedback you've gotten so far from administering AI to those people in the continent of Africa where they are trying to initiate health inclusiveness into the society?
I think before AI, I think my experience started trying to sell insurance when I was ARM, trying to sell insurance to people who were practically in the informal sector. People didn't buy it. They have to prefer to use local hubs, because they trusted the local hubs could work for them rather than going to being able to access care directly. And that was one of the things that influenced us to build social care. How best do you make sure that someone can access insurance or access care when they need it and how they practically need and how they need that. And one thing spectacular we notice is that if we are building AI, we must build AIs that are solutions or make intelligent solutions that are designed in a simpler format that people can easily adapt. And one thing we did is how best do we inform smaller solutions like chatbots, train USSD solutions in such a way that they provide prompts that enable people to ask simpler questions. So this simple prompt allow people to, make informed healthcare decisions. So usually we had significant uptake when we had to introduce USSD. You dial simple code and, it asks you a couple of questions and it start providing relevant answers. So that was how we were able to bring on board significant thousands of people without even having to request them to, download an app, which could have limited access to such level of care.
Okay, but in doing this, do you consider the level of literacy in the rural areas, even though they use a USSD code? Are these messages being sent to them in the local language they can understand so they can communicate? For those who can't actually speak English, if it is sent to them in the Igbo language, in the Yoruba language, in Hausa, Shekiri, or in the Urobo language, so they can be able to respond. Do you encounter any of such challenges, and how were you able to bypass those?
So you cannot build solutions without taking cognizance of how the culture of those locations work. culture is extremely important, and culture is people's way of life. And it's also a reflection on their healthcare and the entire healthcare system. Our goal might be to improve access to healthcare, deepen access to quality care. Because when you talk about care, if people are unable to access care, there's a relationship between care and economic growth. When we talk, the role of AI is to help us ensure that people can access care when they need it. But if actually we cannot ensure care access, what it means is that more families will be pushed into poverty from unplanned medical expense. So bringing in technologies to help us, accelerate care in areas where people need it. And so, the question, coming back to your question around language as a form of as a requirement for care access, yeah, there are similar companies that I know. Currently, we don't do that. We only have a simple English platform that makes it simple for people to access care. But I know a couple of companies like Help Mom, which provides access to care for pregnant women and around vaccination and trying to help, making sure that women and children can have access to quality vaccines. And I know that solutions like that, like their vast solution, provide women and children with access to different languages within 4 or 5 languages in common in Nigeria that people living in these areas can be able to understand in their local language and context.
Okay, I want to ask, when you go out for this project using AI, ensuring that the Nigerians, Africans have access to good health care using the digital system, do you do this alone? Or there are companies in Nigeria, there are investors, there are partners who come in and work side by side with you? How do you go about this?
So you can't build anything in silos. In technology space, with there's some things we call API. So sometimes you are linking your solution. You have an idea, and your idea is to make things simple for someone. So you can't own the entire ecosystem. So what you need to do is to depend on some rails. It could be financial rails, that it could be like payment gateway rails that can help you collect money. It could be like a medical record company that's already existing. You just link in their solution into yours. So you bring all of this together to make sure that the user's experience is great. Because what matters at the end of the day is that the user is able to access quality healthcare when they need it and just how they need it. So it's on you to make sure that all the requirements that are required come together to make that thing work. But at the end of the day, nobody owns it all. So it's just like a bank. There are multiple infrastructures and solutions that link a bank to allow a bank to run financial solutions. Sometimes you hear a bank, they're not working, they're unable to handle payment because they are using some infrastructures that can allow them to enable those transactions. So it is not far from the healthcare system as well. So there are different technologies, APIs that you have to bring on board. Maybe let me use the word partners, ecosystem partners, that you have to bring in together to help you make the work simple.
Okay, just before Priya take you on the next question, I want to ask, you meeting the people is something that is very beautiful, something that, yes, everyone says AI is coming, but what is the level of acceptability by these people? Do people really welcome the idea of saying AI is the one to prescribe certain medication? Do these people want to just to relax and they're not seeing a doctor wearing white with something and all that, and do they really accept this AI work?
You call it AI, and for me, I call it access to care. So it's different things. It means so for me, it's a value proposition, and for a sick person, it's a value proposition that he can access care, irrespective of the solution that is providing care, as long as the care is accurate and it's tested and it's confirmed. So irrespective of the technology that is providing it, it's relevant. Now, people query things when they feel like it is not working or it's giving them wrong diagnosis. But actually, if it's giving you the right solutions, I don't think it is your problem to query what is giving you that kind of good solution. So again, AI is just a technology solution that enables this. There are informed decisions, it has been trained to help make those informed decisions. And I think, like I mentioned earlier, it's phenomenal for us here in Africa. I think we couldn't ask for it. There couldn't be a better time for us for AI than now. We have significant amount of doctor brain drain. Significant amount of doctors are moving away from Nigeria to Europe to get better economic opportunities. This means if you look at WHO recommendation on a doctor to health patient access, that's one doctor to 500 patients. Now you have a case of a doctor, being able to manage over 5,000 patients. Healthcare providers are overwhelmed. Healthcare providers are most times underpaid, and it creates dissatisfaction in their jobs. So what technology does is that technology helps double down the effort of these people, reducing the wait time, number of time people have to assess. You don't have to see somebody that have simple medical cases that trained solutions can help them solve. So this is what technology enables the healthcare providers to do. But it's not that we're completely eroding the role of healthcare providers in providing healthcare.
Okay, thank you very much. Now, we are going to go to the investment aspect of it. But before we do that, let me take you on this question first. Now, before now, during the COVID-19 period, we were told that doctors in South Africa or healthcare providers in South Africa deliver medication to communities and to rural areas using drones. In South Africa, in Kenya, and in some of the northern African countries, that they use drones to deliver medication. In the new powered AI system, though you call it access to medication, which is quite very, very apt, but they don't need to, there's no physical presence of someone they are interacting with. They just press a button on their phone and they are getting the reply. There was skepticism in Nigeria, most especially from the northern part of the country, where they were told at that specific point in time that these are the consequences of COVID-19, these are the things to avoid, and some of them came out to prove it wrong by washing their hands into a bowl, and they did something that was not actually acceptable. So all those exercise or all those beliefs, the traditional beliefs of Africans, have a way of, resisting the advancement of AI into spaces like health and the other. Do you carry out, you and your team, when you work, do you carry out an awareness exercise to inform the people in the local area on the reason for them to actually accept this new phase of access to healthcare?
So one thing in healthcare, there are two things that are extremely fundamental. One thing is ability to finance healthcare. Other thing is access to healthcare. If you're unable to finance it, that means you're likely to lose your life. Or if you're unable to access it, that means you're also likely to lose your life. So there are two things. It's like two flips of a coin, but they are geared towards the same thing. So, and again, when I come back to the insurance space, insurance penetration in Africa is less than 1% out of the entire population, nearly 1 billion plus people. The biggest problem is not that insurance is not doing its job. The biggest problem is trust and experience. People don't trust insurance. People believe that insurance is designed never to work and designed just for the rich. And it's designed again for, it's expensive luxury. And that's why nobody wakes up in the morning and go to the internet to buy insurance. So now coming back to your question, it's similar to the same thing. Now, for insurance to drive and for products like that or something like that to be able to deepen penetration, there is massive need for investment in awareness and education. And this is where the role of agents that distribute those products come in. You are distributing a product. Marketing is good, but sometimes the role of marketing is not just to convince people to buy it, it's to create awareness and the usability of those products. So AI is not different from that. AI, even in healthcare, is not different from that. So AI is a tool that can be used to, help people to get results faster. It's not a.
I think we lost Mr. Nonso Oporum then. Then we'll come back to that conversation. Yes. Now, one of the. Okay, you're back, Mr. Nonso. You're back. Welcome back. Many thanks for joining us. Are you there?
Yes, I can hear you. Can you hear me?
Continue with your line of thought.
Yeah. So from what I was saying, AI is a technical solution. It's a technology solution. It's not the value proposition. You can apply AI in different things. You can apply it in diagnostics. You can apply it in simple medical query. You can apply it in all different fields of healthcare. So it's not just limited to one thing. You can apply it in drug dispensary. So it depends what it depends on the value proposition of that company before you can be able to encourage people to accept not AI but accept the value proposition of what you're trying to sell to them. And so I think we have to phase out the word AI and focus on what is the value proposition of the company using AI to as a service provision.
Okay.
Oh, all right. I don't know. Okay. Oh, Mr. No, so there is talking about distrust, because that was something that you mentioned while you were talking, that people have to trust you. People have to trust AI. In Ethiopia, there is this distrust on AI. So there is issue of AI is going to take our jobs. The AI is going to make sure doctors are not holding on to their job. We don't see doctors in the hospital. So that is an issue in Ethiopia right now. And it is happening in some parts of Africa aside Ethiopia, like Priyi rightly said, using the northern part of Nigeria as an instance. What can we do as Africans? This is talking about the awareness. How do we make people to accept technology? Because right now, this is the age that we are, and it is something that we cannot shy away from. It is something that we will keep talking about again and again and again and again. How do we let people know that AI is not going to take your jobs completely away from you?
Well, I completely agree with you. I've had similar cases of people argue on different things. Even during the COVID, people had warned not to take the vaccine. So it's not a big deal that we'll have resistance to products, or services. We've been in a world that's constantly evolved. From the time of from the time of industrial age, Stone Age till now, for every time we move into an industrial age, there will be introduction of technology. Technology will create more economic opportunities. It will unlock more jobs. It will empower more people. It will make life better. So we are at the age, maybe if I say the fourth industrial revolution, I don't know. But I think for every industrial revolution that we come into, what we see is a different level of economic opportunity, as well as opportunity to live longer, have a longer life. So if you go back to the time of industrial age, whereby we have like automation and people working, let's say when we had more people doing more physical jobs and machines doing more, like during the British time of industrial revolution, second industrial, third industrial revolution, what happened was a significant amount of employees were resistant to machines coming to do the jobs because they believed that machines will absolutely take away their jobs. So they were pushing against those machines because they believe that automation is designed to take my job. So we don't want automation. So change is something that takes time. You don't expect people to embrace change. There's a need for not revolution, but evolution around change. It's a gradual process. People need to see the role of change in their life before they can accept it. So I believe in evolution, not revolution. So we need to figure a way to make sure that people can see the value of this change before they can be able to adopt it as something that has come to stay. So each of these trend and time that has passed, from the automation of machines to industrial age and all of these times, even current to the AI age, it's similar. So we've always witnessed resistance to this kind of technologies, resistance to change. So I think, and I know that AI will also witness this level of resistance, but over a period of time, there will be significant amount of acceptance on AI, not just in healthcare, but across other subjects.
Thank you so much.
Okay. Yes, I wanted to ask a follow-up question on that. Is it possible for companies to design tools that align with cultural and community needs?
Absolutely. Absolutely. So you need to build products that are simple, that are solving people's problem. You need to understand what is working in Nigeria. You can't copy and paste. When you copy and paste, you've only ended up trying to replicate what is not working. Nigeria is not a country that has 0, -0, 10 degrees or something like that. So you can't build solutions that are designed for countries like that are very cold. Either we need to build solutions that are countries that are very hot. And again, so you need to understand the dynamic context of each of these countries, their culture, their food, and all of these things in designing what they're designing. whether it's in healthcare system, if you are designing healthcare solutions, you have to take account of people's culture, people's religion, people's privacy. It's important. So that this is one of the key things that can help to drive acceptability of those products. It's another thing that can help to influencers to create awareness on those products. Now, if influencers are not encouraged about those products, acceptability will struggle. So I strongly believe that culture is a strong determinant when you're talking about building or designing products. So I think you have to take cognizance of culture when it comes to product design. It has to be part of this product design.
Okay, thank you so much, Mr. Nonso. Now, we're going to go on a break. And when we are back from the break, we will be looking at the investment aspect of this, the business aspect of it, the economic aspect of it, the productive and lucrative aspect of it, and why investors or potential investors should pay attention to this aspect. We'll go on a break, and Just Africa will be back in a moment. Mr. Nonso will still be with us. Do stay with us.
Lawyers are concerned about several issues when it comes to artificial intelligence, AI, including data, privacy, compliance, and job displacement. Will AI really take jobs away from lawyers? In this special report, Bayo Olaoye addresses one of those concerns, job displacement for lawyers, as a result of the introduction of artificial intelligence. Will artificial intelligence make lawyers jobless? The short answer to that question is no. There are 3 reasons why AI will not take away jobs from lawyers, according to experts. First, AI systems being developed for the legal industry are primarily co-pilots. Secondly, there are numerous tasks AI simply won't do because legal implications prevent it. For example, litigation. AI cannot make court appearances, unless, of course, nations radically change their constitutions to allow robot lawyers to stand in court, which is highly unlikely. Additionally, for lawyers involved in strategic work, such as security, meeting new clients and existing ones, or serving on boards, AI cannot replicate the human touch. AI lacks the commercial acumen required to build relationship with clients and navigate complex problem-solving tasks. AI cannot engage in the strategic aspects of legal work that require understanding human behavior, negotiating, and making judgment calls. According to experts, AI systems built for the legal industry are designed to function as co-pilots, helping lawyers become more efficient but still requiring human oversight. For instance, AI can draft a clause for you, but as a lawyer, you must ensure that the clause makes sense. AI can assist with tasks like legal research, drafting legal documents, contract review, and identifying red flags. However, human involvement and judgment remain essential, as all systems, particularly large language models, can sometimes be confidently wrong. Despite its potential to assist in many areas, there are numerous tasks AI will not do for lawyers, either because it lacks the necessary capabilities or because it is unnecessary. Some might argue that AI makes lawyers more efficient. A law firm that would typically hire, say, 8 legal associates annually might now only need 5, using AI to assist those remaining associates. While that may be true in some cases, it does not necessarily mean lawyers are losing jobs, as AI will create new roles and open up career paths for lawyers, according to AI industry experts. For instance, AI companies build products for lawyers, require legal professionals just as much as they need AI researchers and engineers. Lawyers are domain experts who know the pinpoints and can guide the development of legal AI tools. In addition, there is the need for lawyers who will build a career in AI governance, working on AI policy auditing, AI existential skills, and AI enlightenment. In fact, lawyers will play a bigger role in AI governance than can ever imagine. For instance, the AI alignment problem is one of the biggest challenges in the industry. There is ongoing research on whether we can solve the alignment problem using the law. As it is known, law is the most democratic aggregation of human values. How do we evaluate the ability of AI systems to follow the law? Or how do we ensure that AI systems do not misinterpret the law in case of unforeseen contingencies? Humans have the Supreme Court to interpret laws when faced with complex scenarios. What will be the Supreme Court for AI systems? These are questions that require both lawyers and AI engineers alike to ensure compliance. In fact, universities are recognizing the growing need for lawyers to build careers in AI. Many institutions are now offering master's programs that focus on intersection of artificial intelligence and law, preparing the next generation of legal professionals for the evolving job market. To wrap up, while the rise of AI will undoubtedly transform the legal profession, it will not cause the widespread job loss that many fear. Instead, AI will make legal teams more efficient and open up new career paths for lawyers. Bayo Olaoye for Souqnews.
Augmented reality (AR) is a technology that merges computer-generated images with the user's real-world view, creating a composite experience. This interactive experience integrates various sensory modalities, such as things you can see, hear, and even feel, making the experience interactive and immersive. In recent years, the emergence of this transformative technology has seamlessly integrated digital and physical realms. This groundbreaking innovation relies on specialized hardware like smartphones and smart glasses equipped with cameras and sensors, AR software, and Apple's AR Kit and Google's AR Core. Then creates immersive experiences by overlaying virtual content onto the
Welcome back. Many thanks for joining us on Just Africa. Today, our conversation has been how to use AI to advance health and healthcare and well-being in the continent of Africa. Our conversation, we've had Nonso Oporum, who is the founder and CEO of Fix Health, a Nigerian-based health tech company, talking to us how we can leverage telemedicine, AI-driven diagnostics, and mobile platforms to connect with doctors across the continent of Africa. Welcome once again to the program, Nonso Oporum.
Thank you. Thank you.
Very well. Now, let's look at it from this perspective. Is AI in tech, in healthcare, is it a profitable venture? We're talking about investment now. Is it a profitable venture, or is it a lucrative venture for investors or prospective investors to look at it and not only want to go in there to make some money, but also to provide the required health services to people both at the urban and the rural area? But first of all, is it a profitable venture that guarantees profit?
Well, like I said earlier, AI is a tool that enables you to do this. And it's absolutely a profitable venture. That's why companies are heavily invested in AI solutions, trying to even find talents in AI solutions. For you to find machine learning engineers, it's a big deal. So, and they're quite expensive. So you see multinational companies investing heavily on people who understand this level of technology and not just people that understand it, but people that understand the scalable frameworks of this level of technology. Now, talking about scalability and sustainability, which is for sustainability means, does it make economic sense for an investor that's putting his money? I'll say 100% yes. Business-wise, if it comes to socialism, you could say, okay, you are investing it because of social good for people. But if you're looking at building sustainable businesses and you are leveraging technology solutions like AI, you're trying to make make let me bring it back to national base now, for example. AI, like I mentioned earlier, there couldn't be a better time for countries like ours to, have AI. For example, if you go back to diagnostics, I think Africa's biggest difference in healthcare system is diagnosis. If people have access to earlier diagnosis on time, we could help prevent more life-threatening medical conditions. For every $1 we invest, trying to understand, run diagnosis of someone, we must have saved $3 to $5. If you put those kind of costs together in just Nigeria alone, you see that we spend nearly $2.5 billion annually on savings that's coming from medical care. Now, AI could help healthcare providers make informed decisions against wrong diagnoses. It could help them, understand early detection and have a prior knowledge of early detections of medical conditions that could be prevented or treated or managed as well. So the role of AI and these machine learnings are that they are trained, to help a company solve their value, bring their value proposition to the patient who actually need that level of care, whether it's in the rural community or in the urban community. But what does this AI or what does this solution offer to this patient? Because we are bringing it down to healthcare. It could mean that it's simplifying those solutions so that the user could understand, the medical need in their local language. It could mean that it's helping me to understand when my child needs the next level of vaccine and when that child needs to be vaccinated or not vaccinated. It could, so because vaccine can help children against vaccine-related deaths. This is where the role of vaccines. And when mothers are not informed around vaccines, we've had similar cases of mothers, building resistance around vaccines because they believe it's not healthy for their child. So this is what machine learning does. This is what informed platforms could do to help you know when the child needs that vaccine, to help you know that this kind of vaccine could help this child prevent this level of killer diseases before the age of 5 or 10. So for every solution that is built, whether it's a direct solution, a SaaS solution, or a telemedicine solution, the role of the company building this is to make profit, optimize revenue. So 100% AI is designed to unlock economic opportunities for the investor and for the company, for the founder that are building those solutions, and even for the government on this on the other side. So in summary, and in answer to your question, yes, 100% AIs are designed to be profitable, to be scalable, and to help solve global problems, irrespective of whether they are healthcare related or other related side that they are required.
Okay, thank you very much. Now, we've seen that organizations that work and they are providing health policy for their staff at work, most of them are linked to HMOs, health management organizations, and others don't. It looks as if it's only those who are within the capture of the HMOs have the accessibility to converse with a doctor or have some form of using the telemedicine device advice to get to of those platforms to be able to administer health to their workers. And apart from that, those who are operating one-on-one insurance also with HMOs, these are the people. When we look at the market in Africa, it's vast. Do you think we have investors who want to jump into the system, or they are skeptical about acceptability?
So I'll give you a typical example. What COVID did to us is that COVID unlocked significant and massive economic opportunity around telemedicine and make people to know more around telemedicine. I think during telemedicine, we had sold, after a while, because of telemedicine, we ran it for a couple of years before COVID came. And during the COVID period, we saw a lot of pharmaceutical companies come to us to leverage our platform to advertise their drugs because we had more inflows of medical providers on the platform. But one unique thing that COVID did was that it closed the world. Everybody was closed. Everywhere was closed. You have to solve your own problem on your own. But even as we live in a closed world, technology connected us. So we lived in a closed world where we were only connected by technology. And it wasn't just physical connections via Zoom. There were also stronger connections with healthcare. Families relied on calling their loved ones. I think I can't breathe, I can't taste. Do you think I have COVID? So these are areas whereby telemedicine had helped to bridge that level of care gap. People didn't need to visit healthcare facilities for simple medical conditions that could be diagnosed using, during having calls online with a telemedicine doctor. Now, the great thing about, now coming back to insurance, which you mentioned, telemedicine usually is an add-on service when you are in insurance, when you are using insurance. Maybe you bought an insurance product. And so underwriters and policy providers understand that there are simple medical conditions that you don't want to see a doctor. As a young person, I was part of youth advocate for sexual and reproductive health, and I understand, the implications of people how people shy away from talking about sexual health. It could be people don't want to talk about STDs. They don't want to talk about, again, there's rude behavior and attitude of healthcare providers. They're being a little bit judgmental on you. So sometimes people want to be behind the veil and talk about their problems. They don't want you to judge them. They don't want to talk about the medical conditions they're having, but they don't need anybody to judge them. And this is what technology does. Again, this is what the insurance companies understood. And they know that one thing they could do, like could be an add-on service, is to provide telemedicine to allow people who have similar cases, smaller cases, who they don't want to physically go and.
Now, when we talk about investment, most of the time we're talking about business. People want to put their money into a business. You put the money in a place where they know that there will be a return. They want to make profits. As much as we're talking about giving people good health care and all that, investors want to have their money back. They don't just want to put it there. So what strategies do you think we need to put in place as Africans to attract these investors into this country, into this continent?
So a couple of the companies have raised money and they are doing amazingly well, even in the insurance space, trying using AI. In the insurance space, they use AI to process claims, make claims very simple so that people can, so underwriters can see there's transparency in the claim process between the providers. So different people are using different AI solutions that, they are making informed decisions. I know companies like PayU, run by my friend, and what they do is to use AI to help, auto industry to make informed decisions around, auto driving, where even if you have a car crash, they provide comprehensive insurance. So people are using different AI, designing simple learning solutions, making it, training their machines to make informed decisions using artificial intelligence, which is the role of AI. And it's not just in healthcare, and investors are accepting this because I've seen a couple of companies that have raised investment, and most of their solutions are AI backed. And as a company, you should be paranoid. I think there's a word that said only the paranoid survive. It's the age of AI. And as a company, you should be thinking of how best do you embed AI solutions in your company to make it more seamless, to improve user experience, to make sure that for us in the healthcare space, to make sure that people can access care just the way they need it. So for an investor and for your board or for your corporate investors, you are looking at how best you can come together, provide AI solutions that can unlock more users, more economic opportunities. Because for an investor, he's out there to look at the scalability of the business. Does it make economic sense? How much is it returning? What is the profit margin of that business? What is the cost-benefit analysis of investing in that company? So these are things that investors look at. And if they see that the business is viable, then there's need to make investment to back such business.
Okay, all right. Now, these investors that are coming, we want them in our health sector. We want them to come and do their magic and help us to curb so many illnesses without necessarily having to get to the hospital. Where would you want them to prioritize? Do you want them to prioritize the diagnostic session, or the supply chain, or the patient data system? What area would you want them to prioritize?
I'm a big fan of. I've been working in the healthcare space for close to 10 years. But currently, I'm a big fan of diagnosis. I have come to understand that 70% of medical conditions, are related to tests. If people don't run tests, those medical conditions could escalate. And we could save significant amount of money if there are early detections of people's medical conditions. So we have to be able to create diagnoses that are simple, that are smart, that are AI driven to help healthcare providers make more informed decisions. If I understand that I have malaria earlier, I can treat it earlier so I can get back to work. Now, if I am not aware of that I have malaria, I could break down, I can stay away from work. So somehow I'm off work, I'm spending money treating malaria, and again, it's affecting the economic productivity I should have offered to the company. So if you look at the uh, economic importance of healthcare, we cannot talk about without diagnosis. So I'm a big fan of diagnosis, and I think investment in diagnosis will go a long way to improve healthcare system in general. Another thing is that you cannot talk about diagnosis without talking about healthcare financing. I'm a strong advocate for healthcare financing, which is the insurance space. And we've been working around hard best to help millions of people to finance their healthcare. We're recently launching in Uganda. We're trying to expand healthcare access in countries like this who have urgent need for healthcare. And again, if there are no solutions that can allow people to have access, finance their healthcare need, again, it boils down to self-medication, whether you're offering AI or you're offering resolution. The uptake of healthcare services is on the decline because of cases of poverty. I think in the earlier days of my career, I went to buy corn on the roadside. I met a woman and she had Indomie. And so she had to share one small Indomie with three of her children. And she was carrying one in her palm. And one thing she shared with me, her experience was that she was saving money so she could get a cough syrup. So that means most of her children had to starve and live on a small portion of Indomie so that she could be able to save money to get cough syrup. It was a devastating experience because one thing I realized that when people are unable to finance healthcare, they make poor healthcare choices. And whether you're talking about diagnosis or you're talking about AI, we have to significantly look at how best do we create sustainable healthcare financing solutions. If we are not able to design solutions that can support healthcare financing, then I think our long-term goal will definitely be eroded.
Thank you so much. Now, let's talk about the government and the role that the government needs to play. If we look at the 2025 budget using Nigeria as a point of reference to other African countries, our budget for health care or for the health industry is just about 2.6 trillion naira thereabout. What sort of policy framework would you advise that government can take and engage in the system so that we can advance AI and through healthcare delivery to every nook and every cranny in Nigeria and in the continent of Africa at large?
I think one thing I believe that government is lacking in the policy of government policy. Government have been trying to run state health insurance schemes for a while, to drive universal health care. But most of them have been struggling. You see most state insurance schemes, maybe a governor comes in, name it after him, after a while, the governor is leaving, those schemes die with the governor. And sometimes people don't want to continue it because they feel like it's someone else's initiative. So I think there needs to be a law somehow that can push that people can have at least the basic level of insurance. We have done that with third-party motor insurance. I don't like third-party motor insurance because I believe that it destroyed the insurance space because somehow people were mandated to buy insurance, but we didn't invest in educating them. We must own a car, you are told to buy insurance. I have a driver that drives me. One day he crashed the car. He told me that he had to pay out of pocket. It didn't make sense in my head, simply because he didn't know the role of his third-party motor insurance, which is that I own insurance, I hit your car, my insurance company will have to repair your vehicle. But he didn't know about it. So he knelt down begging the man and paid him some money. So I think there's a significant level of education gap. Whether we are trying to roll up policies, we have to invest with the National Orientation Agency around education. Education is more important than every policy that we are making. If we are rolling out policy around, making technology a strong part of our healthcare system, creating medical records so that we can track medical histories in sport cases, if there are like an blown case somewhere else, somewhere happening somewhere, we need to make sure that there are legal frameworks, there are policies that are also backed by the National Orientation Agency to invest aggressively on education. So no matter how beautiful those policies are and those laws are, if we don't educate people, we end up creating more problems. People don't trust insurance significantly because of what third-party motor insurance created. We are forced to buy a car insurance as police will hold you on the road. But we are not trained to understand the role of what we can claim when we hit someone's car. But by law, we are required to buy insurance. Then how do I make claim of that? So what ends up happening is that people buy it because it's a requirement that before police will catch you on the road, you need to have it. I don't even know what I'm buying that thing for. So there has to be, when we make policies around healthcare system, we also need to make policies that are backed by investment in awareness. So that if we're making investment to train healthcare providers, if we're making investment in healthcare space to support adoption of technology like other African countries like in Rwanda, we need to invest in educating people on using this level of technology.
All right, thank you very much. So now, when we say that education is not enough, or maybe the amount of information out there is really not enough right now, we still also have to we need you to make us understand, how can Africans as a nation, how can we develop local talents and maintain the standard, maintain that innovation? How can we do this and have our own way of doing things without necessarily depending on the outside world?
I strongly believe in government-private partnerships. I believe in partnerships a lot. Government do the policy side, and private sectors can drive businesses that in ways that can ensure return on investment, possibly to their investors. So that way, there is strong level of commitment and discipline in running the business. So at the end of the day, they are sustainable. What drives solutions are not building them or investing in awareness of policies. What drives solutions are experience of people. We need to build solutions whereby both the entire stakeholders are obsessed with customers' experience. Great companies like Amazon, we are built on customers' experience. Customer experience comes first. Most companies, if you go to banks, they always promote customer experience. So when you walk into an organization, first thing you must understand is that customer service is more important. Every day we must get problems. So we need to build solutions that solve real problems for people, whereby the experience is great. The moment experience of a customer is great, trust me, word of mouth will sell better than even if we're investing in education or awareness of things. I think if we can double down on investment around experience of people, making sure they have great experience, it will create more lasting impact around sustainability of those products, whether we are investing more around creating awareness or not.
All right, thank you so much, Mr. Nonso. Yes, lastly, that's from me. Before PA takes you, I want to read this because I don't want to miss out any part of it. So, Souqcare, a low-cost health insurance platform by Nonso Oporum, designed to further unlock access to optimal health care through access to health insurance for Nigerians, also won $5,000 PVAC Healthcare Innovation Prize each. We want you to talk about this $5,000.
Well, I'm indebted. I'm most grateful for PVAC. PVAC is a presidential asset. I think PVAC was created to improve supply chain around drugs post-COVID. That was one of the things the presidency created, as a platform that can enable that the country can have stronger supply of their own drugs. And I think, to be honest with you, it's one government agency that I visited. I saw the level of intellectual people that are there, the level of coordination, how things were done, the boardroom, their level of organization. It's exceptional and amazing. Not because of the money they gave us, but it's something that I shared internally. You see a culture of excellence. You see a culture of, I noticed something exceptional in their team. They were all driven by very young people. Young people make informed decisions faster. Young people are smart. Young people are non-conformist. They try to, challenge systems and say, oh, no, we cannot do this. So, I watched their culture. It's exceptional because it's built by young people, it's led by a younger person. So it allowed them to make more innovative decisions around how we can improve healthcare supply chain in the country. So I think we are grateful for them for providing us $5,000, which we want to really invest more into something else we are building internally that we will announce to the public. But I think with that, one exceptional thing that for us is that, working with PVAC is a validation for our work, that we are not only building healthcare, but we're also building solutions that could solve the healthcare problems in Nigeria.
Thank you so much. Nonso Oporum is the founder and chief executive officer of Fix Health, a Nigerian-based health tech company that leverages telemedicine, AI-driven diagnostics, and mobile platforms to connect patients with doctors across the continent of Africa. Thank you so much for your time with us, Dr. Nonso Oporum. right here in Just Africa. We really appreciate your time for the robust conversation we've had today, and I'm sure many Africans, including Nigerians, have learned a lot from how you've tried to bridge the gap between AI or using AI to connect doctors and will I say patients and the world healthcare. Thank you so much for your time.
Thank you. Thank you for having me. Thank you.
Very much welcome. I like the conversation we've had, and it says a whole lot about, most especially his concluding remarks spoke about young Nigerians or young Africans who have the knack and the potential to make decisions right on the spot because they've cited the realities on ground. And as far as AI and healthcare is concerned, one thing that is very, very that sticks out of the concept of AI is that it is useful in the healthcare industry, it's useful in agriculture, it's useful in broadcasting, it's useful almost in every industry because it's technology. It cannot be, isolated from anything and every other thing that we do, and that's very good. So reaching doctors, my concern, reaching patients is still those at the ebb of society. And I like the question you asked him about if those who are providing that services are integrating local peculiarities, conventional local peculiarities to what is currently obtainable both in the rural and the urban centers.
Yes, there's a lot that still, I believe that there's a lot that still needs to go into the rural sector, the rural areas rather, because you can't take it away. My grandma at home does not have the knowledge of AI, so I don't know how you're going to talk to my mom, or you just tell her, grandma, you can sit here and you can talk to your doctor. And she will look at you in an awkward way.
Can she use the phone?
Well,
we're not talking about she can use the phone.
No, she can't. She can't use a smartphone.
It's smart, but she can use the other phone.
Yes, my grandma, all she does with her phone is to say hello. That's all.
Okay. So, if she can be taught to answer a phone call to say hello, then she can also be taught to send a USSD code like *123#. No, just a moment. Just a moment. Just to say *123#. And that could be, I'm using that as an example, which could be an emergency line for health, for health advice. And that could be channeled towards maybe *123#0.
Okay.
That you can write down in the wall in the house, and she can take it and do that, and it will respond to her in the Urhobo language.
Yeah, I think
what do you want a doctor to do for you?
I think that's where
right
the awareness comes from. You rightly asked. You asked if our local languages have been integrated into this. Okay, let's come back home. We Nigerians, have we gotten to that point of using our local languages to interact with patients, patients and doctors?
I think they do.
Have we gotten to that point? It is very, 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 very important. And again, it's just that there was no time. I feel some government policies feel that AI is a luxury. Please, AI is not a luxury.
Not a luxury,
It is something that is very, very, very important. It saves costs. You were mentioning some of the benefits. Yesterday, I had to visit the hospital for a checkup. But something happened when I got there. I noticed that, yes, these people, they've really advanced. So I really didn't see a physical doctor at the beginning. They were like, okay, just fill in your information, just type it in, okay, your last visit. And in few minutes, my information and everything was out. And this is what we're talking about. So it saves cost, it saves time, and you cannot overemphasize the importance of AI or digital healthcare, as the case may be.
Also, when going to the general hospitals that are the state or federal general hospitals, it also facilitates hospital decongestion, where the normal crowd that you find there, most people can, because he rightly said that there are some health challenges that you don't necessarily need to sit face to face to have a conversation with a doctor, and you can do that via your phone by just putting in some codes. It will actually decongest the hospitals and make service delivery faster and quicker. In other words, to save time both for the physical medical doctors, for the health officials, and for the patients that will be coming in for health care services that they desire.
Yes. I really love this topic because it is mind-blowing. Yes, and a very big thanks to our guest again. Some of the points he was bringing out, he was mentioning, there are things that people don't really look into.
Yes.
That's especially the investment aspect. That's part that you need to bring in people to come and invest. This is Souqnews. We do business, economy, and development. People don't look at the business aspect. People just feel my job is not safe. When you talk about AI, people just feel my job is not safe. They want to take my job from me. But coming to look at the business, he is so much interested in the diagnostic aspect of it. But there are other people that are interested in the supply chain.
Yes.
I forgot the name of this company, though not in Nigeria. They have a system whereby once you have registered in their pharmacy located near you, you don't necessarily have to go to, when you are in another city, you don't have to go there, go looking for their branch.
Okay.
They are there. Just with your phone, you type in wherever
It's located, the facility is located, they attend to your medical needs.
They attend to you right away. And we have to get to that point.
Okay.
We have to.
Yes, we do have to get to that point. And whilst we are working towards getting to that point, we have gotten to the point right here in Just Africa where we have to draw the curtain and sign off. Many thanks for joining us today. Now do well to follow us on all our social media platforms at Souqnews TV. I am Oyin Priye Kurumale. Do have yourself a splendid day ahead.
And I am Umevi Idolo. Good afternoon to you.